Dr. Larry Tilley, a friend of mine from Calhoun, Georgia, he thought of this example for TMJ pain over 20 years ago. It definitely applies very easily to our knowledge today about sleep apnea. You go to a hardware store and you buy a nice, clean bucket. You take the bucket home, you put it on your favorite couch. Put it there every evening. Then you put some stuff into the bucket, just like John Madden says. He's always saying stuff. So you put stuff into this bucket that you don't want on your couch. Stuff like red wine, chocolate syrup, used oil from your car, coffee. Then one evening you throw an apple core into that bucket. If it's only half full, your couch is just fine. But if that bucket is filled right up to the brim, the apple core will force some of that stuff out, spilling it onto your previously favorite couch. Your body, like that bucket, can only handle so much. If you are depleting the body of oxygen while sleeping with obstructive sleep apnea, then parts of the body get ruined, just like that couch. When the heart is ruined, you can have a heart attack. When the brain is deprived, we can have a stroke. When we can't produce proper amounts of insulin due to oxygen deprivation to that part of the body, you can get diabetes. The bucket analogy is a simple way to realize that every cell and every part of us can fade away long before we're ready for that to happen. So, you saw how the mask looks. Let me show you a few of the over 90 currently different patented oral appliances. This is a CPAP, and these are some examples of oral appliances. They fit over the top and the bottom teeth, keeping the lower jaw and the tongue forward, preventing collapse in the back of our throat. Each one is specific for the need of the sleep apnea patient. The last one's not well tolerated. It keeps the tongue, with suction, fully forward. The oral appliance will keep the tongue and the other soft tissue from collapsing as we sleep and as we relax. This prevents crimping in the back of the airway, which stops air from getting into our lungs. The model seen here, which I designed and patented, shows how oral appliance keeps the airway open. The American Medical Sleep Association and the American Dental Association require that a dentist providing oral appliances and treatment for that must work as a team member with the patient's medical sleep specialist. And that dentist must be well trained in the various issues of obstructive sleep apnea. So when I provide one of these oral appliances, it must be individualized to that particular patient's very specific needs. I choose one of the ones that I've shown the pictures of. There's so many of them, but one person might benefit better from a different kind. That's why it's individualized. And then, initially, I will go to the sleep lab that the medical specialist likes to use, and I'll train the sleep technician, because I want that technician to know how to correctly adjust the appliance so that optimal benefit for that particular patient occurs. The appliances can be adjusted by moving them up and back and forth with a little Allen wrench or a little of other device that changes the position. And when that position is changed, you can have better results or less results depending on the position. The lab tech can find that out while you're sleeping.
Dr. Klein, I'd like to thank you for sharing this very pertinent and timely information with us today. Before we leave, though, can you briefly summarize what apnea is and the treatments that are available to everyone?
Certainly, Joe. Obstructive sleep apnea. It's been with us for centuries. But we just became aware of how dangerous it is. But we've become aware also of how easy it is to control. A mask that blows air into the airway behind the tongue and keeps the collapse of that airway from occurring. An oral appliance that keeps the tongue and the soft tissues protruded slightly forward also keeps the airway open. Wearing a therapeutic device only controls the problem. It doesn't cure it. Like a heel spur, a foot orthotic makes you comfortable. It relieves pressure on the area of the spur. But the spur is still there, even though the foot doesn't hurt anymore. This is a new, exciting field in medicine. And I'd like to end with a quote. A long time ago, 1553 to 1592, he lived 39 years. Montaigne, he was a great philosopher. And he wrote, "Whenever a new discovery is reported to the scientific world, they say at first, it's probably not true. Thereafter, when the truth of the proposition has been demonstrated beyond question, they say, yes, it may be true, but it's not important. Finally, when sufficient time has elapsed to fully evidence its importance, they say, yes, it's important, but it's no longer new." It seems that change has always traveled on a path that is slow. In some ways, this is really good, since it weeds out harmful or wrong changes. Sleep apnea acceptance by the medical community is well along the path to not only acceptance, but to be considered normal medical practice. And Joe, I thank you for allowing me to provide this information. And I truly hope that it can help many people enjoy a better, a longer, and a well-deserved life.
Remember, always ask your doctor so we can maintain a healthy community. I'm Joe Sturza. Thanks for watching Ask the Doctor. If you would like to learn more about how to sleep better, go to Dr. Klein's website at www.sleepapneamichigan.com.
If you do not live in or don't wish to travel to Michigan, the American Academy of Craniofacial Pain is composed of dentists worldwide who treat TMJ and sleep apnea problems. Just go to their website for help.